Well, with our recent rainfall, Houston has become a breeding ground for mosquitoes. Just last week, we reported on a local woman who contracted the West Nile virus. So what do you need to know to protect yourself and your family? I'm joined now by Dr. Sherry Ingraham. She's a dermatologist, and she's here with some do's and don'ts for protecting yourself. We're all getting bit all the time.
Right, we were
Right
just
here,
talking this weekend. We
twin
were
bites.
both bitten, and you know, as women, we wear perfume.
Yeah.
We're out. We're wearing low-cut shirts. We're unexposed here, or we're exposed here, so we're more likely to be bitten because of these things.
Why do you think some people, though, seem to attract mosquitoes? You know, it's not just because they're so sweet.
Right, they're just delicious. Well, we actually know that people who are blood type O are more likely to be bitten.
Oh.
Also, bigger people, pregnant people, heavier people put off more CO2. Mosquitoes are attracted to CO2, so we know to stay less active. Well, that's hard to do. I mean, you don't just want to lay around.
No.
Wearing lighter colored clothes helps. Darker clothes attract mosquitoes. Keep covered, though, is the key, light or dark.
Long sleeves and long pants when you can.
Exactly.
So we know there's so many different kinds of repellent out there. What do you think is really the best? Because we're bombarded with different options.
Right. So the three most important things, you know, it's location, 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 ingredient, ingredient, ingredient. So you want to look for DEET, picaridin, and oil of lemon eucalyptus. And you can get all of these at the drugstore, the grocery store, the hardware store. So these products from Off, actually Off now makes a picaridin product as well as your DEETs. Now the most important thing to know about DEET is concentration has nothing to do with efficacy. It has to do with the length of time it's effective, but not how effective it is. So if you're going to be out for an hour, you could wear a DEET 6%. This Off family spray is a DEET 6%. That gives you about an hour and a half. If you're going to be out for 4 or 5 hours getting your pool and your grill ready, go up to a DEET of like 25%. After 30%, there's a misconception. Anything more than 30% DEET, the efficacy just falls off. Okay. So you just don't need to buy something more than 30%. DEET is very safe. Pregnant women should wear DEET. Children over 2 months of old should wear DEET because we know, it's very controversial, we know that these products are essentially safe. What we also know is viruses like Zika, West Nile are not safe and well documented to hurt people. So if you can protect yourself effectively, you need to do that for yourself and your children.
And quickly, you're a dermatologist, you're all about skin and keeping it beautiful, but we want to scratch, we want to itch, and that can leave scars. What's the best way to try to avoid that?
Right, so what you want to do the minute you're bitten, if you want to put on something, an over-the-counter steroid like Cordaid, something with hydrocortisone, that'll help take the edge off. Ice, an ice pack blocks the spread of histamine in the skin from going deeper. Mentholated products over the counter, things with Pramazone, CeraVe, anti-itch are great. Also, if you feel like you're getting a little infection, get an antibacterial ointment, put it on there. And there are people who are more what we say allergic or sensitive to bites. They get what we call papular urticaria. If you're one of those people up all night itching, take some Zyrtec or Benadryl, take an over-the-counter antihistamine and block that cycle.
Great tips that we are going to need for the rest of as long as our fall summer remains. Dr. Ingraham, thanks so much.
Thank you for having me.